Hey everyone, today I'll be talking about typhoid fever. Typhoid fever is also known as enteric fever and it is an infectious disease which is caused by a microorganism known as Salmonella typhi. The first question which arises is how does this microorganism enters the body of an individual, or in other words, what is the mode of transmission of typhoid fever? Typhoid fever is transmitted through fecal oral route, as you can see in this detailed diagram. The second question which arises is what does this microorganism do? Or in other words, what is the pathogenesis of typhoid fever? Once this microorganism enters the body of an individual, it causes a significant bacteremia. After a few days of bacteremia, this microorganism localizes usually in the small intestine of an individual, resulting in the typical lesions in the Peyer's patches of small intestine. The next question which arises is what symptoms can an individual suffer from once this microorganism enters the body? The individual will suffer from fever which will have a specific step-ladder pattern. Apart from this, patient can complain of headache or can suffer from nausea or vomiting. Also, the patient can complain of abdominal pain or abdominal distension, will have particular rash known as rose spots on the trunk of the body. Also, the patient can complain of muscle pain which is known as myalgia. Children can also suffer from diarrhea or constipation. To confirm the diagnosis of typhoid fever, your doctor will perform certain investigations which can include a blood profile. A blood profile will show altered WBC counts. Your doctor will confirm the diagnosis of typhoid fever by performing a culture. Also, your doctor may advise you to get a Vidal test done, which shows the O and H antigens. Once the diagnosis of typhoid fever is established, your doctor would prescribe you a guided antibiotic therapy after performing a sensitivity test. Fluoroquinolones remain the drug of choice for typhoid fever, but your doctor may go for an alternative if resistance to fluoroquinolones is present. As we all know, prevention is always better than cure, and typhoid fever can be prevented by just one simple step, that is an improved hygiene. We also have certain vaccination available for typhoid fever. So this was all about typhoid fever in brief. Here is the overview of what I have discussed. If you think this video was helpful, do like this video, share this video and subscribe to my channel. Thank you.